Hi there, this is Marielle Conception, your host of the My DPC Story podcast. Have you or someone you care about ever been burned by the U.S. healthcare system? If so, you are listening to the right video, because if you are listening, chances are the answer is yes. But the U.S. spends so much on healthcare. Why are so many Americans affected personally and especially financially by the healthcare system? Shouldn't that mean we have better healthcare access and treatment options? Shouldn't it be easy for us to be able to see our doctor when we need to instead of turning to the ER or urgent care? Historically, it's been seemingly impossible to answer these questions. But now that is changing through the direct primary care movement. This video that you have tuned into will bring you into the world of direct primary care and show you how physicians all over the country are changing the way they practice so patients from all backgrounds get the high quality care they need and deserve, which makes for both happy patients and physicians. Learn even more by subscribing to the My DPC Story YouTube channel. Find us on all major podcast platforms. Find us on socials at My DPC Story and at mydpcstory.com. There you can find resources including how to find a DPC doctor near you, conferences about DPC, DPC startup guides and advice, a store with DPC swag, and even a mapper showing where podcast guests are practicing. Thanks for tuning in to hear about this powerful movement. Now, on to the episode. Direct primary care is an innovative, alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Conception, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care.
Direct primary care means to me restoring the integrity of the relationship between the physician and the patient and putting that back at the forefront and making that, at the end of the day, the most meaningful part of our practice. I'm Dr. Amy Ostic of Health and Healing Direct Primary Care, and this is my DPC story.
Dr. Amy Ostic completed her undergraduate education at both Santa Monica College and UC Berkeley. She then went on to attend both medical school and residency at Thomas Jefferson University in Philadelphia, and then did her community medicine fellowship at Kaiser in Woodland Hills, California. She has just celebrated the 1-year anniversary of Health and Healing DPC. Welcome to the podcast, Dr. Ostic.
Thank you so much for having me. Appreciate it.
I wanted to start by saying congratulations for just passing your 1-year anniversary.
Thank you. It's been wild, and half of that through a global pandemic. So it's been really crazy.
When you started prior to the pandemic, you had 35 patients, and now you've gone beyond halfway to your goal of 400. So I wanted to ask about your startup population. Who were they, and how did you determine your goal of 400 patients?
So my startup population were just a group of folks that I took from my prior practice that kind of followed me, and a few, people in the community that I knew personally, and they were looking for what everybody else, I think, is looking for, which is just a good relationship with a primary care physician. And I had heard so many stories of their not being able to get a hold of their primary care doc, and they didn't have anybody. They couldn't sit, they only spent 6 minutes with them in an exam room. And so these were the people that were really kind of frustrated with the system and ready to make the leap with me. My husband and I sat down and just sort of ran the numbers and decided at first we came up with an aggressive goal of 600 patients as our goal. But then as we started to really run the practice, we realized from a business standpoint, 400 made perfect sense. And it also, I think, enabled us to allow to have that, intimate feeling in small practice feeling for all of our patients too.
Understandable. And, you are in a model where you guys can make that decision, and you as the business owner can, at the end of the day, do whatever the heck you want to do with your practice. And so that's fantastic. I want to touch on the business planning aspect of your DPC. You and your husband, Dr. Brian Ostic, had attended Nuts and Bolts when you guys sat down to create your business plan. Is that correct?
Right. In 2018. Yes.
And tell us about how you learned about DPC, and then how long did you plan before you opened your doors with that business plan that you developed in 2018?
So I think we all have a story about that one person or one colleague that turned us on to the model. And mine is, a former co-resident friend of mine, Ricky Haug, who practices in Philadelphia. He was on the verge of quitting medicine altogether, and he started his DPC practice, and I was following him on social media and saw that he had basically from the ground up built this practice. And I called him out of the blue, just was out of total curiosity as to what it was. For me, it looked like a franchise, like he was starting a franchise or something. And he explained the model, and it was so, just the enthusiasm in his voice was so infectious. I think we're all familiar with that. When we talked to DPC docs, that I had to learn about it. So that was my introduction, and then went to Nuts and Bolts. And again, that enthusiasm just magnified, seeing the happiest bunch of primary care docs I'd ever seen at a conference in my 15 years of being a primary care physician. They mostly, you go to a conference and there's a lot of fatigued, overworked, burnt out physicians. And this was like anything but. So my husband and I were there. We thought that there is some real secret sauce here. So we sat down and marched out a business plan that was really practical and numbers oriented as to how much money we needed as far as capital, where, what that looked like, how we could save that over the course of several months, because we knew we were pretty passionate about not going into debt over this. We had just crawled our way out of student loan debt. So we realized, okay, so if we save, X amount, $50,000, let's say, to start up this practice, we need to save $2,000 a month for a couple of years. And then, so we kind of had that goal in mind, and we decided we were going to do that and just squirrel it away. Well, things got, we ended up doing it more aggressively, because as we got closer and closer, created a domain and really started to flesh it out more. It got so, we were just very excited that we sort of just squirreled away even more money and just were able to save that up in 10 months. And, broke ground, and I left my previous practice in July, was open in September.
Yeah, it's just amazing to hear everybody's timelines and how the planning process and financial prep went into planning everybody's DPC door opening. So, that's fantastic that you guys had, mutual support from each other, but also the support of the community. It's something that I really hope that we get back to soon in terms of in-person conferences, because I hope other people feel that infectious joy of that we don't really experience, in an online sense these days. I wanted to ask, because you have your front office coworker, Anna Maria, working with you. When did you decide to have a front office person with you, and how did you find Anna Maria?
So Anna Maria and I actually worked at a practice together sort of 3 jobs ago now. For me, it was an HMO practice that actually worked with high-risk patients. So patients that were in and out of the hospital, a lot of readmits, a lot of palliative care, multiple chronic diseases. So I had a small panel of, 50 to 100 high-risk patients. So she was really like an everything for those patients. She was not only an MA and did medical vitals and checked, drew labs, but she was really a coordinator and was very good at hand-holding with patients and follow-up. So I knew that was the kind of person I wanted in this type of role, like somebody that was not afraid to do front and back office stuff and be really approachable for patients, and also, take on their issues in terms of medical issues and try to help them in every way possible, come from a place of yes. And that was her mantra. Now, unfortunately, it burnt her out in the typical system because it just wasn't feasible. But in this model, it works really well. That type of personality where she's just kind of a giver, it works well because we have plenty of days that are slower, so we get to refuel and we kind of feed ourselves that way. So that's how I found her, and I would be absolutely nowhere without her.
That's wonderful. And, I think that is something key to people who are looking to hire somebody who might be an MA or a front office person or someone like Anna Maria who's serving as all of the above. When a DPC doctor is trying to find a coworker, it is very different when you have someone who is looking to come on board and they completely 110% believe in the model versus somebody who doesn't really know what the difference between DPC and fee-for-service is.
Yeah, and I think the model too, like she didn't really understand it 100%. And I would love to, once we do get back into in-person conferences, love to take her next time because I think she'll drink that Kool-Aid and feel the feels and finally get some content that makes more sense. But I don't think I was okay with that. Like I'm still teaching and we're still talking about how DPC is different than concierge and how DPC, how we are unique in what we do. Because I don't think she fully understood it initially about price transparency and how we can, have wholesale medications in-house and cash labs. That was something she kind of learned as she started, and now she fully understands, but it's a paradigm shift for a lot of people. So I just wanted somebody that was a really good quality person that would be just a patient advocate and my patients would love. And she would love the DPC model as soon as I explained it.
When you are onboarding new patients in your practice, how do you onboard them? Do you have a meet and greet or do you do something different?
So the meet and greets I have are for like prospective patients. Those are mostly now obviously kind of telephone, virtual, but I was having sort of an open house even once a month to kind of have prospective patients come and do a walkthrough or meet and greet. When I onboard a new patient, I try to get them all in for an initial intake to really just get their full, basically a physical, but really also get their full medical history, get any old medical records in there. And then also so they could see the practice, and it's my opportunity to kind of explain how we can help them financially too. Because a lot of patients come on board to my practice just because, they want me or as a PCP, so they still don't understand the DPC model. So it's just another opportunity. So I like to bring them in for an initial intake, and that's usually about an hour to 2 hours of talking and exam and labs and everything. So
awesome. And do you do your meet and greets on certain days of the week or do you spread them out?
So they were more spontaneous. They're sort of scattered. And so they were never, initially we were trying to do them once a month. And then with this pandemic and it being a little bit difficult to have people just walk in, we're just kind of putting them in between patients or on Fridays.
What about the people who are both prospective members and the people who are already enrolled? You and your husband are amazing at producing blog content and also weekly video content on YouTube. And I wanted to ask about how does your media involvement touch your members and how much time do you devote to social media?
Oh, this is my husband's, passion. Like he just likes the numbers and playing with. So that was always the marketing thing really interests him. And in the very beginning, it was kind of a scramble to find out what worked and what didn't. And then, with COVID, there has not been a lack of content. And I think because it felt like a lot of people, were shut in and not able to go out and maybe come and see me as readily, or even be out with people, I felt like the internet was this new source of spreading good quality medical information. So that was what really prompted us to do the weekly video. And so actually, so the monthly blog that I put out, oh gosh, who gave me that idea? There was another DPC doc that gave me that idea. That the reason why I decided to do that was because I wanted to remind my current members kind of A, that we're here for you, B, that you're getting some good content monthly that is reminding you of health maintenance things and preventative care, nutrition, but also giving you some like evidence-based information on COVID, et cetera. So that was really for my members. And then the weekly videos are kind of more on the marketing perspective. We spend, the monthly video takes me a few hours on a the night before or the weekend before to put together. And it's really just a great way for me. I don't know. It's a great way to exercise that creative brain and put something together like that I don't think we have the time or bandwidth to do when we're in the regular fee-for-service world. But that's what I've loved about DPC, is that I have that spark and that in that kind of interest. But and then the weekly video content has my husband and I put together. It's definitely ad lib. We decide on a topic and then we'll put together something, a few hours beforehand and then kind of go ad lib. But the trick of that has been more how to push it, on Facebook, how to find, how to do some paid advertising and YouTube. And that's been kind of trial and error to figure out what works. And yeah, I think people like it because I think they feel like it's a consistent, stable, either myself or my husband giving some good evidence-based, medicine on whatever COVID or non-COVID related medical topics.
You guys are definitely effective in your videos, especially. I love that, you touch on different topics, mental health of people going off to college. What is the difference between bacteria and viruses? I mean, things that we might, talk about on a daily basis, but to highlight that for your patients is really wonderful. I think that's great that you have that target blog for your members specifically, because you're right. I mean, they're involved in this relationship with you, and that is strengthening that relationship. With regards to social media, on a couple of your latest videos, you and your husband have been incorporating like a gift card giveaway for one lucky winner. How did you guys achieve that? Like, are these cards donated? Do you buy them? How do you incorporate that in your social media videos?
So he has probably like 3 to 4 marketing ideas a day. And I say no to about 90% of them because I don't know, they just seem kind of cheesy to me. And eventually he's like, okay, you have to let me just try one of these things. He just likes the trial and error aspect to it. So he came up with the gift card, probably also on DPC doc form. I bet I'm trying to think if he did. He's just, everybody loves a giveaway. Okay, fine. So we tried it, and we just bought the gift card, and then the person that won it, it was a local person. So we just Facebook messaged her the gift card, basically the e-card. But it was fun. And I think it created some engagement. People had to comment on the video, and obviously had to watch the videos to know that there was a giveaway. And it was fun. I think it created a little bit of lightheartedness to it also. And I think then probably will spur some more viewership the next week, expecting maybe there's another giveaway or whatnot. I mean, it's really interesting. This is a whole new field of study for me, this whole marketing thing. But it's been fun, and we have a great time together thinking about different ideas. But I just keep reminding him, I'm like, I'm not, I'm not like FabFitFun, like this is like a monthly subscription to Fab. Like I'm a primary, I don't know. So there are some unique differences. So
I really love though that you guys are doing this as, best friends and as a married couple. I think that's so fun with you venturing out and opening your own business while he's still practicing as an emergency physician. It's just great because this is something to just build into your relationship. And although he does have different views on marketing. It's cool that you guys are collaborating like this. I really love that.
Yeah, it's been really fun. It's something that for sure has given us, that other intellectual layer. We've always been, we were study partners in medical school, and we are best friends. So we really love doing this together. And he is for sure my biggest cheerleader and supporter. So it's been awesome. I absolutely never thought I would be a small business owner. That just was never in my purview at all. So I've needed the encouragement along the way for sure.
In terms of balancing family life and your DPC, how is it going with regards to balancing your kids' schedules? Because the last I heard, they were doing homeschooling just because of COVID restrictions in LA.
Oh yeah. So we're pretty shut down. And I need to stop looking at the daily numbers because it keeps making me more depressed. We were pretty far away from dropping down in California. It's color coded right now. We're in the most restricted. And so once we drop down to the second, tier 2, we can go back to school, and we're just nowhere near that. So it's, they're all remote learning. We didn't have to hire a babysitter. We didn't have one before. I have a kindergarten, a 3rd grader, and a 5th grader. So the kindergartner definitely needed somebody with them the whole time. And it's been very challenging. And I think but it's at the same time, I'm so blessed and so happy that I'm in this model, because if I was in a very structured, rigid system like I was in the last few jobs, there may have been some allowances and flexibility, but I doubt at some point they're just going to say, sorry, you have to be back in the office 8 to 5, and that's that. There's no way that, so this way I definitely am home more earlier. And if I absolutely need to be there for something, I can carve that time out. So it was so fortuitous that I'm doing this at this time.
Yeah, it's something that you hear pretty much from every DPC doctor parent out there, that you have the freedom to wrap your practice around your family and your children's schedules, especially. With regards to the pandemic, you are offering coronavirus testing. So I wanted to ask about, how did you manage getting the coronavirus tests, and how do you administer tests to your patients?
So yeah, we were actually pretty early on that, because we just had such a hard time securing lab supplies in the very beginning. And my nurse is just a hoarder when it comes to that. So as soon, before the pandemic even started, once she was able to order Quest supplies, I remember she said, I just don't want to ever have the wrong tube for something. So she got like 30 of every tube. So when we started the pandemic, I was like, oh my gosh, we have the right test. So we were able to quickly we had the testing supplies, we were able to test, and then through DPC networks and DPC docs and California Syndicate was able to find another vendor. And that was amazing, because that was also very quick that I, found Health Check RX. They were awesome. So really quickly, we were offering, within the first few weeks, in fact, local hospitals were sending their employees to us because they didn't have the testing supplies. So we were doing PCR testing right out the gate. And that was huge, because we really had a lot of cases in the beginning. And then I also coincidentally had a Quidel machine that I purchased. I decided I wanted that as a good point of care test for flu and for strep. And so we had that machine. So when it came time, when the cartridges and discs were out in July, it took a lot of bullying at first. I was like bullying my McKesson rep. I was bullying my Quidel rep. Kind of weekly emailing them, when are they out? I want some, because I knew that we weren't going to order, 100,000 tests. We were going to order, 100. So I knew we were on the last of the list. But so we did get those early in July. And so we have rapid testing and PCR testing. And then the algorithm, as far as who to test, is just, I haven't come up with a good one with that, because it just presents like every other URI infection. And so we've just tried to be a little diligent about using the rapid tests, because they're expensive. So I only, really test symptomatic patients. And then the PCR I use for screening and or backing up the antigens.
Gotcha. And do you do your testing while the patient's in their car, or how do you administer?
Yeah, we definitely we decided our protocol would be anything upper respiratory. I was going to examine in the car, and if I felt like they needed a COVID test, I would do it in the car. And then certainly any screening or close contacts, so it's all done in the car.
You have 2 psychologists working with you, providing mental health care for your patients, and they have still been able to work with your patients in a virtual manner. Is that
right?
Correct?
So they're doing right in February. We kind of came up with a contract with these 2 psychologists, and they would see my patients at a reduced rate. They take insurance. They work for another practice, but my patients they were going to see for $89 an hour, which I thought was great. And within a month, when the COVID started, they both went virtual. So they were meant to be in my office, but now they're all teletherapy, and I've utilized them hugely, and they've been a huge asset. Yes.
That's a wonderful price point. I mean, locally, the minimum amount to pay a psychologist, I think, is around $115 to $150 is usually what people pay. And minimal insurance is accepted locally. When they see a patient of Health and Healing DPC, do they have access to your EMR and their notes get integrated? How is that working for you?
So that we were going to, when they were face-to-face, we were going to have them just scan their notes into my EMR. They were going to keep their own paper notes if they were my patients. But now with all of this happening, it's a little, they sign a release with, the patient signs a release that it's okay that we talk. So we kind of talk verbally about patients, and they give consent. So that's been kind of how we've been dealing with it now. But they keep their own records through their own systems. Yeah.
Did you advertise for psychologists, or did they find out about your practice through your patients?
One of them, Dr. Cadena, is a friend, and so she works, and her kids go to school with my kids, and then this is one of her colleagues. So they've even done neuropsych testing on some of my kiddos for ADHD. So they've been a huge asset for my patients. Yeah.
That's wonderful. I want to shift the conversation to the fact that you're a member of the DPC Alliance. Can you share with the listeners what that means to be a member of the DPC Alliance?
So it's a membership. It's a group of DPC docs that I think are organized, to my understanding, to kind of provide, number one, discounts on different vendor services. So and also just names of people that are reputable for, a home sleep study or, EKG or Holter monitoring or EKG machines or medical supplies. So that has been a great resource, because I just go to their website and I look to see, and they'll sometimes negotiate a discount. But again, I think most of the time it's just when I think, gosh, I wish I had a way to get spirometry, and I'll look on their website and look, I can order this and it's this much. And they've already kind of done half the work for me to find out how much it costs. So that's been really useful. And then it's a group of good docs, and their Facebook, they've done some great little events on legal matters with DPC. And then we've done some COVID stuff too. And then also advocacy and policy issues. So they'll kind of touch on that. They have different speakers to speak on those things virtually that I've attended. That's been really awesome.
Great. Thank you for sharing that, just because the people who might be starting out and hearing of all these DPC groups that are out there, that's important for them to know about what the DPC Alliance is. So thank you for sharing that. I have become a huge fan of podcasts. Ever since Sarah Koenig hosted the first season of Serial, I was hooked. Now, creating this podcast has become part of my daily life. While it is an exciting new hobby, I also see it as a privilege that I get to interview so many DPC and direct care doctors. If you are interested in starting a podcast, let me tell you a little bit about Anchor. First of all, it's free. There are creation tools that allow you to record and edit your podcast right from your phone or computer. Anchor will distribute your podcast for you so it can be heard on Spotify, Apple Podcasts, and many more. You can make money from your podcast as well with no minimum listenership. It's basically everything you need to make a podcast all in one place. Download the free Anchor app or go to anchor.fm to get started. I wanted to ask about your organizing, the DPC docs within the state, and just to tell us a little bit about this and like your goals with that.
James Gower and Matthew Abenante are like the front runners on that. Now, to my understanding, it would be it's just so, because DPC is so unique and regional, even though it's great to have friends across the country at DPC, it's certainly more useful from my point of view, running a practice, to have more local friends, because we can share resources and all that, but then also stay kind of on top of like the unique California legal challenges about running a DPC, and what does it look like if we have, a kind of Medicare for all kind of system in California, and how does that, we kind of are like a little nation state here in California, so there's very unique systems in place that I think is a different conversation outside of the national conversation. And James and Matthew are just great resources for me. And so getting organized and also having people in various stages of their practice is really helpful, especially locally. So I hope eventually, I think it would be nice if we were a little more organized and kind of more of an advocacy group for policy change in California. But I tread lightly there because I don't know enough about who's already involved and all that. So that would be kind of cool eventually.
There's so much potential in DPC doctors organizing themselves with and without policy changes. Just, even the idea of having, because we all know the MAPR exists, but having each other vetted as providers, as doctors, if we have a patient who is moving down to, the
Right.
Irvine area, I can make that reference to you or to Halcyon, or to Matthew's practice. But yeah, it's, you are so right in terms of the California nation state within the union. I want to ask some questions that I ask of everybody in terms of tech or tools that you use and love. You mentioned your Sophia test for COVID testing. Do you have any others that you want to highlight?
I love my Atlas MD. There's lots of different EHRs out there, but what I love about Atlas is that the billing part of it is really user friendly for me. And that was something that really does take up a lot of time, is just keeping track of billing and people paying for different things, whether it be, their labs or with this or that. So it's very easy and it's one system. And I feel like I haven't had to outsource that yet, which is good because it saves on my overhead. And also keeps me, and that's what we do too often, I think, as physicians, is we sort of, say uncle too early and delegate something to somebody. And then all of a sudden there's, we wonder where our money's gone. So I wanted to be in charge of the money, even though I don't have a business degree, but that's okay. It's just, addition and subtraction. So I love the Atlas billing. And then I think, as far as like tools, yes, I have the Sophia. Then I have a lot of, I just did get a Holter monitor, and that is through TZ Medical, and that's pretty awesome. And that worked out really well and was really easy. And that's awesome because that's just such an easy thing to do without having to send a cardiology referral that can cost $500 and unnecessary tests. You could just do it for $65. So those are two great ones.
In addition to the DPC Alliance and other doctors that you reach out to one-on-one, are there other resources that you recommend highly to others in terms of if they were researching DPC or if they were looking for ways to improve?
Yeah, I think the DPC frontier is good because that's all of the dry, boring legal stuff, but it's important. It's a great, just if you have a legal question about whatever, about Medicare opt-out, about in-house dispensing, whatever it is, it's right there and the language is there and it's fairly updated. So again, it's something that you have access to freely and securely, so that you can feel comfortable that what you're doing is above board. So I love the DPC frontier, and I check that from time to time just to make sure, and OSHA stuff and all of the employee stuff and tax and some of the tax legal issues too. So that's a good resource.
For those who are interested and interested in or about to make the jump into DPC, do you have any specific words of encouragement to help them along their journey?
I think that the biggest hesitations are, I don't want patients to be able to have 24/7 access to me. That's one big hesitation. And then the other hesitation is just kind of the risk and the capital and the money part of it. And I think, you don't want to jump off the dock before the boat pulls in. So I think taking the time to march out a business plan that seems really reasonable and feasible to you and really specific about numbers and digest that can make you feel comfortable about doing it. Just going to the bank and getting $50,000 in loans and then jumping off the dock you're going to set yourself up a little bit for failure because you don't have all of the kind of expenses marched out. So, and that's all easy. I mean, Josh, that's another resource. Josh Umber, Dr. Umber can email you like the DPC list, the checklist. And that's what we use to march out our business plan, like what we needed, what supplies we had to buy. So march out a really nice detailed plan. And they also say that like 80% of the happiness with a vacation goes into planning it. So like we loved planning the business before we even started. It gave us like a sense of joy and purpose. So even though it seems tedious and a lot of work, it actually was really enjoyable too. So that was surprising to us. So planning, and then the other part of the access with patients having 24/7 access is that is, I definitely on the clinical realm am busier than I ever have been, but I'm way less busy on the administrative burnout end of it, where I'm documenting, and writing notes at the end of the day and dealing with referrals and dealing with, administrators. So that's kind of where I'd rather spend my energy is with patients and triaging issues. We all have to work on boundaries, and I'm still working on boundaries and how to secure those better. I don't come from that doesn't come naturally to me. So I have to be better at that, but that's okay. Like I'm fine tuning those along the way. And I'd much rather, every time a patient calls me, I'm happy that they did. So as opposed to, running to the ER or just letting it hang on for another day. And that's kind of why we're here. This is the time to step up for our patients. More importantly, they need us more than ever right now.
Couldn't agree more. For those who want to reach out to you, what's the best way to get a hold of you after?
Oh yeah, you can email me. It's my full name, AIMEE Ostic, OSTICK @gmail.com. Yeah, they can just shoot me an email there. And I mean, I would love to set up a time to chat about wherever you are in the process. And we definitely need more DPC docs. And like everybody says, you've seen one DPC practice, because everybody's different and what their needs are as a physician and then what their patients' needs are. So there's definitely things to learn from other people, but it may not be the right specific layout, and that's totally fine. There's definitely a demand. So it's out there.
Thank you so much, Dr.
Thank you for having me, Marielle. Thank you.
Next week, look forward to hearing from Dr. Jasmine Singh of Dr. Jasmine Singh Psychiatry. Until then, this is Marielle Conception. For more information on this episode and much more, please visit mydpcstory.com.